The recent pepper spraying of a 9-year-old girl here in Rochester is leading to an important conversation this morning. Dr. Elizabeth Murray joins us now to talk about the adultification of black youth, what a new study reveals about how adults view black girls. Actually, the study here, Girlhood Interrupted by Center on Poverty and Inequality in Georgetown Law. A very bold report here. Dr. Murray, before we jump into that incident, revisit that here, what happened in Rochester a few weeks ago, let's jump in with adultification. What does that term mean?
Right, it's so important. It means the loss of childhood for children, basically treating children as if they have more adult qualities. And so this data is showing us that when people look at black youth, both boys and girls, the newest data is looked at girls specifically, is that the perception is that these children need less supports. They're more independent. They have more adult qualities. And this is happening for children even down very young ages, 5, 6, 7 years of age. So you can understand why this is important to pediatricians.
Yeah, as young as 5. A 5-year-old child viewed as more adult-like or older?
Most definitely. And so this is a clear case of we have this information and we need to use it to do better. The people involved in this study, it was a large study, a nationwide sample of adults, mainly white adults, mainly college-educated people who were asked a variety of the same questions in response to what do they think of black girls versus white girls. And so the same questions were asked, and across the board, these answers bore out the same of this adultification of the black youth. And so you can see how this could boils over into all of our systems that interact with children, whether it be in school, interactions with police, and certainly we know interactions within the healthcare system. You know, we as a profession are not immune to a history of biases as well. You know, if we look at some aspects of healthcare, how we looked at kidney disease for many, many years, the genetic makeup of humans is almost exactly the same regardless of who you are. And so we now know the biases are very real. It's the social determinants of health that are making African-American people have greater risks of high blood pressure and diabetes. It's not that they are genetically different by no means.
Sure. There's a lot to unpack here, and I wanted to go back to adultification. The report notes that it can take 2 essential forms, and one of the things it notes is that the maturity level, and it references resources and or lack thereof resources and community environment. And we know that there are instances in many of these communities where some children, particularly in black and brown communities, they are forced to be the adults as maybe their parents are working multiple jobs to take care of the family. So I was wondering if that is taken into consideration in this study as well for why maybe children are perceived older.
I think it's part of it. I think all roads lead to loss of childhood experiences, though, whether it be because of outside factors making you need to grow up more, but then also these other factors of this perception of needing less nurturing or not being as lovable, and these just kind of outside things being put upon the children. Again, it all leads to lack of normal childhood experiences. And because children are perceived as, those children are perceived as being more adult-like, they are often punished more severely. They have greater expectations placed upon them. The simple kind of childhood slip-ups that many children make, they are punished for instead of just saying, all right, well, you're a child, because again, the perception is you are more adult than you are and you should know better. And so therefore you deserve a harsher punishment.
So much more to talk about. We're going to continue our conversation. We have to take a break. I know we did talk about that incident that happened a few weeks ago here. We're going to kind of look at the parallels with this study, with that. And what do we do with this information moving forward? We'll be right back. Any scattered snow showers we see this morning will taper. We'll see partly sunny skies, highs in the lower 20s. We continue an important conversation this morning about the adultification of black youth. Dr. Elizabeth Murray joins us now with more as we talk about the potential implications of this study as it relates to discipline, whether it's in school or in the criminal justice system. We recently had an incident a few weeks ago, which you had touched on, with a 9-year-old girl who was pepper sprayed by police. That incident has drawn criticism from all across the board. What parallels do we see as we look at this study and looking at this incident of how this happened? What do researchers see here?
Well, first and foremost, we heard the statement of stop acting like a child. I am a child. And I think, as pediatricians, we're experts in child health and child development. And so it's time now to use the right lens. If we look through the correct lens, then we can see things clearly. And so we know that this is a phenomenon. The adultification of Black youth is a phenomenon. And so we need to start looking through the right lens as to how we can fix these problems. And these are going to come through systemic changes. And operational changes. And so back in 2019, the American Academy of Pediatrics released a statement on racism, because we know that racism is a core determinant of health and the social determinants of health as well. And so we can team up and work to fix these problems, but it's going to take some major systemic changes. But pediatricians are available to do that and to help.
Yeah, it's interesting because I don't know whether we ever have the right answer right away. Certainly, you and I both don't know what it's like to walk in the shoes of a police officer and the challenges that they're faced with out there. But we've heard from mental health experts. We've heard from pediatricians, doctors like yourself, who talk about maybe addressing a child with trauma in this such a situation. What seems to be the starting point where we avoid a situation like this, where we can truly work together?
I think acknowledging that it exists, first and foremost, is important. I mentioned some of the examples in the history of medicine. We as a profession certainly are not immune to this at all, and we've acknowledged it, and we want to continue to acknowledge our flaws and where they've been. And I think all professions need to take that approach as well, because once you understand this data, then you can use it to do better. This is not data that provides an excuse. This is the data that provides a call to action. And so we can use this to do better, to improve training, to improve understanding. Again, this is not unique to one career or another, but we know the outcome is the same, and it is detrimental to children.
This is a bold study when you look at the title of it. I'm sure it will ruffle some feathers. But now that we have this information, what do we do with it as a society? I know you mentioned we know better, we can do better, but what should people every day do? We all have biases. What do we do with this information moving forward?
So we can look at the social determinants of health. When something happens, what is the root cause of it? I think in general, people don't enter into a situation choosing or hoping that they're going to make a bad decision, right? People enter into it with their training or with their experiences. And so what are those experiences? And we know that children in the Black community have increased rates of incarceration. They have increased rates of poverty. There's a lot of things that are impacting their physical health. So we can work to advocate to fix some of those problems, improving access to care, improving the social determinants of health by making sure we get the kids out of poverty. Rochester has one of the highest rates of childhood poverty in the nation. So we can work on that, and that's going to take, again, some systems change. Pediatricians are screening for all of these health inequities and working with partner agencies in the behavioral health world, in the social services world, to help with some safety nets. But when these things come up in the news, I think this focus on blame can be very distracting away from let's work on the root cause and fix the problem. It's going to take advocacy from all of us because we are all in this together.
Yeah, the conversation definitely continues, as does the work. Where can people go to find the full report so they can read it in its full context and read more for themselves?
Locally, the Children's Agenda is a fabulous resource for all sorts of data and information that impacts the youth of children. So I would turn to their great website first and foremost.
And we'll make sure to put a link as well on 13wham.com. Dr. Murray, thank you so much for your time this morning on this important conversation. All the best to you.
Thank you. You too.
All right, local headlines with Chris coming up next.